Okay. طيب. Key communication strategies include introduce yourself clearly and confirm who you are speaking with. Acknowledge distress. It sounds like this is example of a statement. It sounds like things feel really overwhelming right now. Use open questions initially, followed by more focused risk assessment questions. Demonstrate active listening and summarize what she tells you. Maintains a non-judgmental approach, particularly around self-harm. Offer reassurance that supports the support is available and that you will pass information to the team. GMC guidance on good medical practice emphasizes listening to patients, treating them with respect, and acting if a patient may be at risk of harm. Even though this is a simulation, you should demonstrate appropriate concern for patient safety and confidentiality. On a crisis line, it is important to confirm the patient location and ensure that there is a plan if risk escalates. دي حاجة أنا مختلفة شوية عشان هي في التليفون. You need to understand where the location الحتة اللي هم قاعدين فيها. Key areas to explore in the call. Your assessment should balance emotional support with risk evaluation. Important areas to include current emotional state. What has happened today that led her to call? How is she feeling right now? Has something specifically triggered the distress? Risk assessment. Ask directly about thoughts of self-harm or suicide. Explore intent, plans, access to means, and previous attempts. Ask whether she has already harmed herself tonight. Safety and environment. Where she currently is and whether she's alone, whether she feels safe where she is, whether alcohol or drugs have been used, support network, whether anyone is with her could be contacted, family and friends and partner involvement, any current mental health support, care coordinator, therapist, GPs, coping strategies, what has helped her during past crisis, whether she has tried anything to help calm herself down, and closing the call. Before ending the call, summarize the key concerns and explain that you will relay the information to the home treatment team so they can consider appropriate support. Encourage her to stay safe. If relevant, suggest simple grounding or coping strategies while she waits for further help. Remember that your goal is not to fix the crisis, but provide containment, gather essential information, and ensure that the team can make informed decision about the next step. حاجة تانية إيمان زي أي كيس كويس. أدي العيان فرصة يتكلم بعد ما تسمعيه حتى ممكن تسأل السؤال. لما بيجوا اتنين بيتكلموا مع بعض في المقاطعة بيحصل confusion وبعدين sometimes might come across as you're rushing the patient. فشوية بس pay attention to الحاجة دي انك ما تقاطع العيان ودي فرصة يتكلم. جاهزة؟
Okay. حاسة التاسك يعني to do a full history taking and
It's
risk
not
assessment.
full history. It's more about validation of emotions when somebody is in crisis
Okay.
and try to
Mhm.
gather information about what happened right now. بالذات and it's more about risk assessment and what triggered the
Okay.
current crisis. You're just dealing focus. It's a focused assessment بالآخر. لكن depending on
Okay.
الزمن. لو الزمن أكتر شوي ياخذ لكن it's a focused assessment في الآخر المفروض شكلها هنا.
Okay. Okay.
Okay. جاهزة؟
إن شاء
Begin
الله.
simulation.
ليه يعني هنا بسم الله ما شاء الله.
شكله لسه ما دخل.
اي ما اعرف لقيت.
ده غالبا ده النت، لكن كده اوريكي حاجه، انا هحاول تاني اخش من عندي اذا لقيته.
تمام.
ال... انا ما افتكر في سبيس، متاكد في سبيس بين الحاجات دي في الباسورد ذاته.
ما يكون ما في، ما اعتقد انه يكون في سبيس.
كده هحاول اخش من غير سبيس.
انا صراحة حاولت هسه هنا لكن لقيته، لانه اصلا حافظة هنا الباسورد فخش معي طوالي يعني لقيته مفتوح.
انا ما دي المشكله ذات الدقيقه، حاولت تاني يعني.
السلام عليكم.
عليكم السلام.
آه، ما قادر أدخل كويس.
كده دقيقه ما اعرف اليوز مايكروفون دي عندك انت ولا وين اللي عم المفروض يعمل فيها لاو؟ شوفي هنا يمكن ده واقف بس عشان الميكروفون ولا حاجه، اللي هو على الشمال فوق، يوز مايكروفون عملي الاو. الاو.
آه.
اه بالله كده ارجع تاني جو باك. انا الى الان حالك ما يدخلني.
جيت انا اتاكد نعمل بروسيد. شو اللي بيعمل لنا كده؟ نرجع
بروسيد.
من الاول ولا شو ما نعمل؟
آه امشي ولا خلاص بس خليه يقفل بعدين ترجعي تعملي تاني.
اوكي.
لانه ما عمل حاجه.
ايوه نرجع تاني معنا. جو باك.
ما حيديكي امشي للهناك، امشي للداشبورد تاني على الشمال. اعملي في اللايبرري، امشي في اللايبرري، اعمل سايكاتري تاني. يلا سكرول داون تاني، فتشيها تاني. هذه لا تاني تحت، طيب. اعملي continue stimulation ولا ريست. وكده ارجع تاني معلش.
ما مشكلة. نعمل back to the library.
باي. اعمل ريست هنا. ايوه. يس. كده اعمل begin simulation. سكرول داون وامشي. proceed. proceed. begin simulation. start.
الحمد لله. أعتقد إنه كده ممكن تبدأ لأنه
ايمان ممكن تبدي.
Okay. Hello, Billy. How are you doing? I'm Dr. Iman, the psychiatrist in charge today.
Honestly, not great. I'm just really all over the place tonight. Everything's sort of blown up and I can't calm down at all.
Okay, I'm sorry to hear that. Okay, just I want to tell you that everything you tell me,
Right, okay.
that will be very confidential here. So be comfortable and be calm. Okay, please.
I'm trying, I'll try, but it's just hard right now. I'm proper wound up and my head's all over the place.
Okay, I can feel that. I'm sorry for
Yeah.
that. I'm
Sorry,
sorry for
what do you
that.
mean by that? I'm not sure I follow,
Okay.
sorry. Could you just say that again? My brain's a bit scrambled tonight.
Okay, can you just tell me, please, what brought you here today?
I've just had a proper shit day and I'm all over the place. Had a massive row with my mum, then kicked off with my boyfriend and ended things, and now I can't settle at all. I just feel like I'm losing it.
So, when did this happen? When did this happen?
It all kicked off earlier today. The argument with my mum was this afternoon, and things just spiraled from there.
Okay. What about your mood being last days?
It's been up and down, to be honest. I've been a bit all over the place for a while, but today just tipped me over. 1 minute I'm angry, then I'm panicking, then I just feel empty. It changes really quick.
Okay, for how long?
I don't know exactly, but I've had these mood swings for years, really. It just gets worse when stuff like today happens.
Okay, Billy.
It's Bailey, but that's fine.
It's Billy. Okay, thank you. Okay, can I ask you some
All right.
questions just in order to know what's your problem
that's
exactly?
fine.
Okay, if you don't
Yeah.
mind.
Yeah, that's all right. Go on.
Okay,
All
have you
right.
been okay? What was your appetite and sleep like in the last days?
Both have been rubbish, to be honest. I'm barely eating, just not hungry, and my sleep's all over the place. Can't settle, keep waking up, or just lying there thinking too much.
Okay, have you experienced any periods of hyperactivity for the last months or days, or any periods of talkativeness or irritability?
I do get proper irritable and snappy, yeah, especially when I'm stressed like this. I wouldn't say hyperactive, though, just more restless and on edge. Sometimes I talk loads when I'm anxious, but it's not like I'm buzzing with energy or anything.
Okay. Okay, during this problem, have you been experienced any hearing voices when nobody is around?
No, nothing like that. I don't hear voices or anything weird. It's just my own thoughts doing my head in.
Okay, have you been seeing anything that no one can see?
No, I haven't. Nothing like that. Just feeling overwhelmed, but not seeing things.
Okay. It's just a routine
Yeah.
questions. Sorry.
Yeah, I get it.
Any
That's fine.
Okay. Any strange smells
It's all
or
right.
any okay. Any strange smells or any odd sensation over your body?
No, nothing like that. Just feel tense and shaky, but no weird smells or anything odd with my body.
Okay. Do you feel that anyone is trying to harm you?
No, not really. It's more me I don't trust right now, not other people.
Sorry, can you repeat to me? I didn't get you.
I said, no, I don't feel like anyone's trying to harm me. It's more that I don't trust myself at the moment, if that makes sense.
Okay. Anyone is following you or spying on you?
No, nothing like that. No one's following me or spying on me.
Okay, do you feel that you have special powers or abilities? Or you are important than others?
No, nothing like that. I'm just struggling. No, I don't feel like
Okay.
I'm more important than anyone else. I just feel a bit useless, if anything, right now.
Okay. Okay,
Right.
do you had any thoughts about ending your
Yeah.
life around all that happening?
I've had thoughts about it, like wanting to just not be here or take a load of tablets or something. But I haven't done anything, and I haven't got some proper plan. It's just scaring me that my head goes there.
Okay. So you tell me that you had that thoughts, but you didn't prepare for something like that.
Yeah, that's right. I haven't set anything up or made a plan. The thoughts just keep popping up, and it freaks me out.
Okay, so what stopped you from acting on these thoughts? Can you tell me, please?
Honestly, I think I just got scared. I didn't want to actually go through with it. And I remembered the crisis number from ages ago. I guess I just wanted someone to talk me down, so I didn't do anything stupid.
Okay. Can you tell me, have you ever thought about harming
Yeah.
others?
Do you mean self-harming? If so, yeah, I have. I cut myself a bit earlier tonight. It wasn't deep or anything, just, I don't know, I was desperate.
Sorry, can you explain that to me?
I just
What
got
did you
really
do?
overwhelmed after everything kicked off, and I couldn't cope. Cutting is just something I've done before when I'm like this. It helps in the moment, but I know it's not good. I just wanted the feelings to stop for a bit.
Okay.
Yeah.
When was that?
Earlier tonight, after the row with my mum and then splitting with my boyfriend, I just lost it for a bit.
Okay. So, do you have
Right.
ever been
Right.
aggressive or violent to others?
No, not really. I might shout or say stuff I regret when I'm upset, but I don't get violent with other people. It's more I turn it on myself.
Okay, I'm sorry to hear that. I know you are experiencing
Yeah,
difficult time.
thanks.
I'm sorry for that.
Right. Thanks. It's just
Okay,
been a rough time, honestly. I just want to get through tonight without making things worse.
okay. So around all this, are you able to look after yourself?
Yeah. I
Are you
am,
being able?
mostly. I live on my own, so I have to. It just gets hard when I feel like this, but I can still do the basics if I really push myself.
Okay, so you are living alone.
Yeah, I live alone in a flat in Bath.
Okay. Okay. Do you
Right.
use any medications
Yeah.
or take any substances?
No, I'm not on any regular meds at the moment.
Okay, what do
I
you
don't
take,
smoke
please?
cigs or anything. I do use weed a couple of times a week, just to switch off. Not had any tonight though. I drink socially, but that's not really the issue right now.
So you drink occasionally, not always.
Yeah, I know. Just being honest with you.
Thank you for being honest. Okay. What type? Do you drink alcohol? How many times a week? Billy, are you with me? Hello, Billy? Billy?
Yeah, I'm still here.
Okay, sir. I didn't hear you. So okay, I want to
No
ask you.
worry. I just said I don't really drink much. Just so.
Okay.
Yeah, go
Okay.
on.
Around all this, how do you
All right.
cope with the difficult times you get? Belay? Belay, are you with me? Hello, Belay? Belay?
Sorry, I'm not sure what you mean. Could you say that again? My head's a bit all over the place tonight.
No, I couldn't hear you. Sorry.
That's okay. I'm still here. Just let me know what you want to ask.
Okay. So, I want to thank you for being honest and cooperative.
All right. Yeah, no worries. Just trying to be straight with you. I just want to feel a bit less all over the place, you know.
Oh, okay. Okay, have you went before to any psychiatrist or any mental service?
Yeah, I have. I was under the
When was that?
I was under the home treatment team a few years back. That was a few years ago. I was under the home treatment team for a bit. Did some therapy stuff back then. Not seen anyone properly for ages though.
Sorry, can you repeat that? I didn't get you.
Yeah. I said I was with the home treatment team a few years ago and did some therapy then, but I haven't seen anyone properly for quite a while now.
Okay, what therapy did you get? Or medications?
Sorry, I'm not sure what you mean by cinnamon. Did you mean something else?
No, what did you get for medications or therapy?
If
Any
you mean what help I
rehabilitation?
got, Oh, right. Yeah, I did some therapy back then. Stuff like DBT, I think it was called. Had some appointments
Yeah.
with the home treatment team, but not much since then.
Okay. Is there any contact with your family? Are they close to you?
Yeah, I do talk to my mum, but it's complicated. I do speak to my mum, but we argue a lot. That's what set me off today. I don't really have much other family close by or anyone I can properly rely on.
Okay, I can feel that. I'm sorry.
Yeah, thanks.
Okay.
It's just a lot sometimes.
Yeah. Any familiar psychiatric problems in your family?
Not that I know of. No one's ever really talked about that sort of thing in my family. It's just always been a bit messy, to be honest.
Okay. Do they have any chronic illness?
Right. Not really, as far as I know. No one's mentioned anything major.
Okay. I would like to ask you some questions
Yeah,
about your background to help me to get a whole picture about you.
yeah, that's
Is
fine.
that okay? Okay. What about your early childhood, if you
Yeah, that's
remember?
all right. Go ahead.
Okay.
It was
Can you
pretty
tell
rough,
me
to be
about your
honest.
early
Lots of arguments at home. Never really felt properly safe or. What do you
Okay,
want to know?
I want to know what about your early childhood, if you remember.
All right. Like I said, it wasn't great. There was a lot of fighting at home, and I never really felt settled or like I could trust anyone properly. It just always felt tense.
Okay. Okay, how was your relationships with your siblings? Do you have siblings? Sorry.
I don't have any siblings. It was just me and my mum, really. That's all right.
Okay.
No worry.
Okay. Oh, any significant illnesses? Any significant illnesses or traumas or abuse during your childhood?
I'd rather not go into detail about that, if that's all right. It wasn't easy, but I don't really want to talk about the specifics on the phone.
Yeah, it's okay. You have the whole freedom about that. Don't worry.
Thanks. I just find it hard talking about that stuff.
It's okay. Don't worry.
I'm already sitting, but thanks. Just trying to stay calm. All right.
Yeah, you can feel very free about that. It's okay.
Thanks. I appreciate that.
Okay. Can I know if you are in a current job right now? And what is it?
Yeah, I work part-time in a pub. I pick up extra bar shifts when I can. Just trying to keep things ticking over.
Okay, what about your education level?
I finished school, did my GCSEs, but didn't go to college or uni. Just went straight into work.
Okay. Okay, can I know what do you do in your free time?
Yeah. Honestly, not much lately. I just watch telly, scroll on my phone, or hang out with mates if I can. Sometimes I just keep to myself. Nothing exciting, really.
Okay. Okay, have you ever had any problems with police before?
Right. No, nothing like that. Never been in trouble with the police.
Okay, okay. So,
Yeah.
yeah. Um, um, how do you cope with that difficulties in your life? What do you do? I know it's very hard to be alone and
Mostly I just try to distract myself. What? Yeah. Yeah, it is. Nights like this are the worst. Just feels like everything hits at once and there's no one around.
yeah, it's really hard.
Yeah, it feels like everything's just too much sometimes.
Okay. So you told me before that you didn't get any substance or any
Right.
any drugs before.
Yeah, that's right. I said I use weed a couple of times a week, just to switch off, but not tonight. I don't do anything else, and I don't take any proper drugs.
Okay, did anything in the past help you get through difficult times like the DBT you get before?
Yeah, bits of DBT did help a bit back then. Stuff like grounding or distraction, but when I'm this overwhelmed, it's hard to remember what to do. Sometimes it works, sometimes my head's just too messy for it.
So it wasn't regular. بليه؟
اعتقد الزمن خلص بعد كده.
بي... بي...
يلا نبدأ بالشباب نشوف إنه الحاجات ولا نبدأ بإيمان يا دكتور ياسر؟
إيمان أو انظر.
طيب نبدأ بإيمان.
Yes. I think I didn't show empathy يعني in the right way.
What do you mean?
يعني أنا حسيت إنها she's desperate كده و stressed وأنا ما يعني أنا ما وريت empathy شديد يعني.
أوكي. أي شيء تاني؟
آه، يمكن risk assessment ناقص I think.
شنو؟
risk assessment.
أوكي. زي شنو مثلا أنت كنت عايز تاخذي تاني إذا كان عندك الزمن؟
مم، ما عارفة لكن حسيت إنه ناقص.
أوكي.
حسيت إنه ناقص. ممكن كان يعني هي زي ممكن تتكلم أسألنا more about the aggressive behavior or violence وكده.
نفتح الباب للشباب نشوف. Any comments؟
السلام عليكم. I
السلام.
think هي كان قالت أثناء الانترفيو إنها she had a trial بتاع DBT dialectical behavior therapy. ف you you didn't ask her أو digging deep في الجانب ده أفتكر. يعني what about sessions هل كان في improvement ما كان في improvement في sessions كده.
سألتها في النهاية إنه هي الحكاية كانت كيف معها. actually أنا بس حصلت لي مشكلة إنه ما قدرت أفهم نص كلامها يعني، فكنت بقول لها عيديه عيديه.
Yeah, you did well والله يا دكتورة ما شاء الله ما في مشكلة. يعني بس أنا حبيت إنه أسأل إنه الشبكة قطعت لي فحبيت إنه أسأل إنه هل سألتيها معلش.
لا it's okay.
السلام عليكم. برضه يا إيمان بالنسبة للدي بي تي، كان برضه ممكن تسأليها إنه أنت ليه وقفتي أو السبب إنه do not continue الثيرابي ليه and why has it been a while.
هاي هاي لكن هي براها مش قالت إنه أنا حسيت إنه الموضوع ما يعني ما مشى كويس معي، نفعني في البداية حاجة زي كده. أنا ما
هي بالعكس قال نفع في البداية يعني.
هي قالت نفع في البداية ما بعد ده يعني أنت أفهمي عنده.
أوكي.
ثانك يو عمر.
السلام عليكم. It is good يا بس أنا حاسس إنه زولا دي كانت بتشير إنه عايزة توديك على emotional assessment أكتر، فلو كان مشيت على
شنو؟
emotional assessment. بس أنا حاسس إنه الزولا دي كانت دايرة توديك assessment. يعني إنك تمشي ديب شوية في الأسسمنت أوف emotion.
أي ما أنا قلت في البداية أنا ما عملت emotion support كويس I think يعني.
مش emotional support، لكن أنا أفتكر إنه لو مشيت على المود assessment
آه
والcoping mechanism الريليشن strengths and all
مهم.
that.
يا محمد انا ممكن اخش معاك في الحته دي. انا افتكر زول ضرب لك تليفون قال لك I'm not feeling well. انت you asked him exactly. دي الحته الاولى انا افتكرها. Open ended question. Why are you calling me today? فهي if she's calling you about suicide انت you should be immediately يعني هنا يعني showing empathy and at the same time discussing exactly so what's going on, what is happening. You evaluate the current situation. Why she's currently calling you. حصل شنو? Why she's calling you. What's happening right now. She's safe, not safe. انت افتكر في مشكله انه حصل disconnect انه you immediately jumped into talking about appetite and sleep. فدي اول حاجه. this disconnect between you as an interviewer or as the person who is assessing the patient with the patient who they want to kill themselves, they want to hurt themselves. وبعدين جات لك I don't feel safe. انت you moved on again. دي حته I don't feel safe. This is an important cue. هي رجعتك للسيفتي. انت you kept going on with the checklist بتاعت الاسسمنت لحد ما جيتي للsuicidal evaluation. If somebody is talking about suicide, well, she's throwing this for you, you come back. This is the main issue. Until you verify, you clarify, you focus on this. بعدين you go to the other checklist evaluations. فدي حاجات كانت مهمة. حاجة ثالثة أنا أفتكر اللي هي البيريودز بتاعت السايلنس دي. This is alarming. هي دي ما internet connection issue. If somebody is talking to you about suicide وبعد شوية سكت في التليفون, and I would clarify, hey, can you answer? I'm worried about your safety. You have to reflect انك انت you're concerned about the safety. You have to evaluate the safety. بالذات سكت منك مسافة كده.
انا افتكرت بيقطع اكتر يا اخي.
لا ما it's not. في الحتة زي دي زول سكت معاك في التليفون سكت انت you have to worry about safety concern.
افتكرت بيقطع مني. اوكي.
Right? ما انا فاهم لكن this is not like this is somebody who just basically was talking about suicide, somebody who's unpredictable who became quiet suddenly. انت you have to verify your safety.
اوكي. اوكي.
فانا افتكر قبل ما to move on a checklist way يعني انت you should open-ended questions زي هي البيزكس في الاخر. Open-ended questions, what brings you here, what's going on. Based on the report انت you go on with what they bring in the table. You go with a checklist later on for verification مش من الاول. فدي major disconnect حصلت بينكم الاثنين.
اوكي. I'm sorry for that.
لا ما it's not you don't have to apologize. This is a feedback في الاخر الليله عشان تنتبهي ليها عشان just to evaluate to strengthen. It's not a mistake. It's a feedback.
اوكي. اوكي. شكرا كثير ياسر.
عارف دكتورة مهجة دكتور عبد الغني عشان افتكر we need to move on to the next case عشان الزمن. إذا أي input في الكيس دي.
طيب نمشي للكيس اللي بعده. ما أعتقد في حاجة.
منو
الحقيقة كان في المين يعني ايشو في الكيس ده اللي هي الريسك اسسمنت زي ما قلت، خاصة انه هي يعني هنا كلمت معاه في التليفون وهي زول بوردر لاين وكده. ف الريسك اسسمنت السوسايد او السيلف هارمينج، هي حتى هي قالت لها يعني يومين انه انا هارم ماي سيلف. فهي كان مفترض انه يكون التركيز كله على الموضوع ده في البداية، بعد ذاك تجي باقي الهيستوري. آه واعتقد انها هي دي حاجة كويسة، يعني ده كيس كويس شديد للشباب.
ايوه. شكرا دكتور مهجة.
طيب نمشي اللي بعده. نمشي اللي بعده طوالي يا دكتور ياسر.
أيوه بس منو الزول الجاي الثاني who's the second person.
لا دكتور
السلام
ياسر.
عليكم يا بوس، أنا أحمد مصطفى.
اوكي.
تمام أنا أفتكر أقراها.
تمام.
Chimaka Okafor. You are speaking by the phone برضو by the phone with Chimaka Okafor, the mother of Chukodi Okafor, a 5-year-old boy affectionately called affectionately called Chuck. Chuck is described as being completely silent at school despite speaking normally at home with family members. He has caused Chimaka significant worry as he does not understand why this is happening. An initial assessment has already taken place during which Chuck remained mute throughout the session. You are now making follow-up phone call to Chimaka to gather further background history about her son. It's child psychiatry assessment في الآخر بالتليفون, just gathering collateral information. It's a history taking. Pre-reading and selective mutism is a complex Childhood and anxiety disorder characterized by child inability to speak and communicate effectively in select social settings such as school. These children are able to speak and communicate in settings where they feel comfortable, secure, and relaxed. Understanding selective mutism, the ICD-11 selective mutism is classified under disorders specifically associated with stress. This aligns with the understanding that the condition is an anxiety-driven. It is essential to differentiate this from other communication disorders and recognize its roots in an anxiety. NICE guidelines, while specific NICE guidelines for selective mutism are not available, general principles for guidelines related to child and adolescent mental health services and anxiety are applicable. These emphasizes early identification and multidisciplinary approach and importance of family involvement in management, communication skills, and questions to ask. Engaging with the child suspected of having selective mutism and their family requires sensitive, empathetic approach. Begin with open-ended questions to the parents or caregiver, allowing them to share their observation and concerns. It is crucial to create a non-threatening environment showing understanding and patience toward child condition. Onset and context of behavioral changes. When did you first notice shame, reluctance to speak in certain situations? Are there specific places or other in front of whom Shane does not speak? School and education psychologist involvement. Has Shane been seen by educational psychologists at school? Can you share any feedback or report from the school regarding Shane's interaction with peer and teachers? Is there any history of bullying or negative experience at school that might have contributed to Shane's condition? Home environment. How does Shane communicate at home? Are there any differences in her communication at home versus other setting? Have there been any recent changes or stressors in the family or home environment? Developmental history. Can you tell me more? Can you tell me about Shane's early development milestone? Were there any delays or concerns? Has Shane experienced any serious illnesses or hospitalizations that might impact her communication? Differential diagnosis consideration. Have you noticed if Shane's silence is selective based on the setting or people, or is it more pervasive? Investigation and treatment. Investigation. A thorough physical and neurological examination along with psychometric testing is crucial. Assessment by an educational psychologist and possibly speech and language therapist are essential steps to rule out other causes and understand the extent of Shane's condition. Treatment. It is highly individualized, focused on gradually exposing Shane to her feared social situations in a controlled and supportive manner. Behavioral intervention, including positive reinforcement and desensitization strategies, are often effective. In some cases, family therapy or cognitive behavioral therapy may be recommended to address underlying anxiety. Prognosis. The prognosis for children with selective mutism is generally positive, especially with early intervention and comprehensive multidisciplinary approach. However, it is important to set realistic expectations and prepare the family for a potentially gradual improvement process. Common pitfall to avoid: overlooking the need to a comprehensive assessment before making a diagnosis. Just want to make sure انت دي في الاخر ما عندهم مشكله بتاعت communication ولا hearing ولا اي حاجه تانية ولا intellectual disability. Failing to consider the child's environment and potential stressors contributing to the condition, not involving a multidisciplinary team, and overlooking the importance of educational psychologists and speech therapists in the assessment and intervention process. Remember, selective mutism typically presents in early childhood, not significant gender differences is prevalent. It is correct. افتكر this is the same. في الآخر it's an assessment with the mother on the phone. جاهز؟
Hello. Yes, this is Mrs. Okafor. Sorry, I wasn't expecting your call. Is it about Chuck? I hope everything is okay. I have been so worried since they told me he didn't speak at all during the assessment. Please, can you tell me what is really happening with my son?
Okay, my name is Dr. Ahmed Mustafa, psychiatrist. I will be helping you today. I'm calling you to following up
Thank you, doctor.
on your son.
Thank you,
Can I ask
doctor.
you
I
when
appreciate
was
you
the
calling.
first assessment?
Honestly, sorry, doctor. I'm not sure I understand your question. Do you mean when did the assessment
Can
finish,
I?
or are you asking about something else? The school just told
I'm
me he
asking
didn't say
when.
anything during the session, but they didn't give me much detail.
Mm, I'm asking you about when was the assessment done.
Yes, doctor. The assessment was already done last week. They just told me afterwards that Chuk didn't speak at all the whole time. Since then, I have been waiting to hear what will happen next. At home, he is talking as usual, so I don't understand why he keeps quiet in other places.
Okay. What other places other than school he's keeping quiet? What other places other than school he's being quiet?
Sorry, doctor. I'm not sure I understand what you mean by calling in 55. Could you please explain? I just want to know what is happening with Chuck and if there is anything I should be doing for him now.
I will ask you some more questions to elaborate what is going on.
Yes, doctor, that's fine. Please go ahead and ask. I really want to understand what is happening with my son.
Okay. What other settings that your son do not speak on it other than school? Did you hear me?
حاول ترفع صوتك شوية، احتمال يمكن ما سمعتك.
طيب. I'm asking about what other setting does your son does not speak in? Can you hear me?
Hello, can you hear me? Hello? دكتورة مهجة تقدري تعيدها تاني؟ شكله في مشكلة بتاعت شبكة في هنا، شكله جلitches هنا. يلا نعيدها تاني. دكتورة مهجة، لو عملتي فينش بعدين عملتي ريست ورجعنا تاني للكيس، افتكر انه في جلitch ما شغالة.
أظن ما سامع لأنه دكتور موجة عاملة ميوت.
احتمال
آه.
ميبي لو دكتورة مهجة عملت ميوت
أيوة.
احتمال يكون قفل الموضوع.
لا ما قفل، هو خلص finish.
Yes, doctor. I am here. Sorry
تخيلي
if I was slow
احسن
to
اعملي
answer.
فينش وارجعي تاني،
I
لانه
just want to
شكلك
make
عملتي
sure I
ميوت.
understand everything.
اوكي، اعمل finish وابدالي من الاول.
لو عملتي ميوت ما حتسمعنا شكلها، لان
All
هي
right,
شغالين
doctor.
بالميكروفون
I am
بتاعك.
here. Please take
ايوه
your
مهجة،
time.
بس ابتدي
I am ready
من
to
الاول
answer
يا
any
مهجة.
questions you have.
اوكي.
Sorry, doctor.
جو باك. ايوه بس ثاني. library specialty psychiatry. السايكاتري دي ايوه. سكرول داون.
مم.
هاي بس دكتور ماجي ما تعملي ميوت من عندك، لو عملتيها شكلها ما حتسمعنا.
خلاص تمام اوكي. نعمل proceed ولا go back؟
باك اعملي ريست.
اوكي.
Back again. Go back again. Go back. ما ينفع إذا ترجع لها من برا.
إلا proceed إلا من برا.
إذا من برا تاني بس اعملي ريست قبل ما تخشي.
اوكي.
مش بتمشي للريكوردينج بس يا ياسر، مش كده تمشي للانترفيو طوالي
هاي
بدون
طوالي هاي.
البريفنج. ايوه.
اوكي.
طوالي.
مم.
Hello, doctor. Thank you for calling me. I have been very worried about Chuk since the school told me he is not talking at all there. At home, he's always chatting with me, but once he gets to school, he just keeps quiet. I really don't understand it, and it's making me anxious. Please, what do you think is happening to my son?
Hi, my name is Dr. Ahmed Mustafa. I'm psychiatrist. I called you to gather more information to assess your son's situation. I will be asking you some more questions. Can I?
All right, doctor. No problem. You can ask me anything you need to know. I just want to understand what is making Chuck behave like this, because it's really troubling me. Please go ahead.
What did you notice that Chuck has been different lately?
The main thing I noticed is that since he started school, he just stopped talking there. At home, he is his normal self. He talks, laughs, even argues with me sometimes. But once he gets to school or anywhere he doesn't know, he becomes very quiet. His teacher says he won't answer questions or even greet anybody. Sometimes when there are many people or too much noise, he just keeps to himself and won't say a word. That is not how he is at home at all.
How been this been going for? For how long this has been happening?
It started when he began school, so about 5 or 6 months now. Before that, he was mostly at home with me, with family, and he always talked. The silence only started after he joined the school. Since then, every time he goes there, he just keeps quiet.
Okay. Does he
All right,
been
doctor.
silent in other?
If you need me to explain anything
The-
more, just let me know. I really want to understand what is happening with my boy.
Okay. Did you notice anything other than him being silent in school?
Yes, doctor, there are a few things I have noticed. Sometimes, if something changes suddenly or if the place is noisy, he gets upset or covers his ears. He also likes to play alone a lot, especially with his favorite toys. He can spend a long time just lining up his animals or trains. At home, he sometimes repeats the same questions over and over. But the main thing that worries me is that total silence in school and around people he doesn't know.
Okay. Does he been silent other settings than school?
Sorry, doctor, I'm not sure I understand your question. Do you mean does he stay silent on purpose or does he try to talk but cannot? From what I see, it's like he just
Yes.
can't bring himself to speak in school, even if someone talks to him. At home, he talks freely, but in school or new places, he just keeps quiet and looks down. I don't think he's doing it as a joke or anything like that.
Okay. Uh, 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 so, does he talk also with other people other than you at
Sorry,
home?
doctor.
Like with his father or siblings if he
Yes,
has that?
doctor. At home, he talks with me, with my... Yes, doctor. At home, he talks with me, with his auntie, and sometimes with my friends if they visit and he knows them well. But if it is someone he doesn't know, he might be quiet at first. Still, with family members or people he is used to, he talks normally. It is only in places like school or when he is around strangers that he becomes silent.
When you are separated with him, does he feel anxious? Hello? When he separated from you, can he be anxious?
Yes, I think he can be anxious sometimes, especially when things change or if he is in a new place. For example, if we go somewhere he doesn't know, he will hold my hand tight or hide behind me. If there are too many people or loud noises, he sometimes covers his ears or looks very uncomfortable. But at home, he is relaxed and happy.
Is he reluctant to leave home? Is he reluctant to leave home?
Leave. Leave.
Can you hear me?
Yes, doctor, I can hear you clearly.
Can he be reluctant to leave home? Does he refuse to leave home?
No, doctor. He has never refused to leave home. He goes to school every day, even though he is quiet there. Sometimes he is a bit slow to get ready if he is tired, but he does not refuse to go out or leave the house.
Does he refuse to be alone at home?
No, he is not alone at home. I'm always with him, or sometimes his auntie is there too. He prefers to play alone sometimes, but we are always around him. He is never left by himself in the house.
Yeah. Okay. Does he complain about
All right, doctor.
being anxious sometimes?
He doesn't really complain or say that he is anxious, but I can see it in the way he behaves. If something is making him uncomfortable, he might hold on to me or become very quiet. Sometimes he just says he doesn't want to talk, but he doesn't use the word anxious. It's more from his actions that I notice.
Does he sometimes have palpitation or sweating from anxious situations?
Sorry, doctor. Okay, doctor. I have not noticed anything like depression in him, but I am not sure what to look for. At home, he seems happy, he laughs, plays, and talks with me about his favorite things. He eats well and sleeps well. It is only when he is outside or in school that he becomes quiet.
I will ask you some questions about his early life. How was his delivery? Was it normal
That is
delivery or had some complications?
His delivery was normal, doctor. There were no complications. He was born on time, and everything went smoothly. I did not have any problems during pregnancy or when giving birth to him.
What about his milestones? Did he meet it regularly or it was lacking?
He met his milestones on time, doctor. He started walking and talking at the usual age. In fact, he started speaking early, and his vocabulary was good at home. I did not notice any delays in how he developed when he was small.
Did he complain about hearing loss or other physical complaint? Did he complain about hearing difficulties or other physical complaint?
Sorry, doctor. No, doctor. He does not have any problems with eating, except that he can be a bit picky sometimes. He likes to eat the same kind of food and may refuse if something smells or feels different, but he is healthy. Apart from that, he has no other physical complaints. He is not sickly and does not have any health problems.
So he does not have any hearing difficulties.
No, doctor. He does not have any hearing difficulties. He hears me well at home and responds when I call him, especially if he's not too focused on something. His hearing seems normal to me.
Okay. Did your son complain about being bullied at school? Did your son mention that he has been bullied at school?
No, doctor, nobody has told me that he was bullied at school. His teacher never mentioned anything like that. And he has not complained to me about anyone being mean to him. The main thing is just that he is very quiet there.
Okay. Have he done any assessment with with a psychologist with a psychologist at school?
Okay, doctor. Thank you for letting me know. If you think it will help him, I am willing to try anything. I just want him to feel comfortable and be able to talk in school like he does at home.
Has a school psychologist evaluated him?
All right, doctor. I understand. If the psychologist needs to see him again or if there is anything I should do at home, please let me know. I really want to support him in any way I can.
I'm asking you, has the psychologist evaluated him before?
Sorry, doctor. I'm not sure what you mean. Do you want to know how the psychologist saw him or what they did during the assessment? I was not inside with them, but I know they tried to talk to him, and he kept quiet the whole time. If you need more details, I can try to explain what I know.
Yes, can you explain? Does the psychologist did a developmental test?
Hello, doctor. Sorry, doctor.
I'm here with you.
I don't really understand what that means. I wasn't told anything about a denominator test. They just told me that he didn't speak during the assessment with the psychologist. If there's something specific you want to know about what happened, please explain it to me.
I'm asking about did they did some testing to assess if he is if he's developmental
Okay, doctor, I understand. If you are trying to
my
assess him for something, please let me know what you are looking for. I just want to know what is really going on with my son so that I can help him.
what I'm asking about is did they test his developmental status? Is he delayed or something like this? Did you get me? Can you hear me, Mom?
Are you still there?
Yeah, I'm here. I'm asking about has he undergone any testing to test his development status?
Sorry, doctor. I didn't quite understand what you just said. Could you please repeat or explain it another way? I want to make sure I answer you properly.
Has he undergone any testing regarding his developmental status?
No, doctor. No, doctor. He has not done any special tests for his development before now. This recent assessment with the psychologist was the first time anyone checked him like that. Before, nobody ever said there was a problem. At home, he was always developing well, so we did not think he needed any tests.
Yeah. Are there any triggers for his anxiety or conflict at home can be causes of this? Did you get my question? Can you hear me? Can you hear me?
الزمن انتهى يا مهجة. Time is over.
باقي دقيقتين، لا باقي دقيقتين ونص.
Okay.
Sorry, doctor. I'm not sure I understand what you mean. Could you please say it again or explain it differently? I want to follow what you are saying about my son.
I'm asking you about situation at home. If there is any anxiety triggering situations like conflict or something like this?
No, doctor. No, Sorry, doctor, I don't understand your question. Could you please say it in another way? I want to give you the right answer.
How is the situation at home, the atmosphere at home?
Doctor, at home things are calm. There is no problem or fighting in the house. I try to make sure Chuck feels safe and comfortable. He is close to me and we have a good relationship. His father is working in Nigeria, but we talk to him on the phone. There is nothing at home that I think would make him act like this in school.
Uh, uh, does he have any friends? Does he has any friends? Can you hear me? Can you hear me?
خلاص زمان خلص يا محمد. finish.
Uh,
أقدر من القصة بتاعت إن هي ما سمعتك وفي مشكلة كانت في التواصل بتاع إن هي ما سمعت السؤال، فهمت السؤال غلط. What else أنت could يعني أنت you think يعني how do you think it went? What else can you أنت لو أخذت فرصة تاني هتعمل الموضوع ده كيف؟
I will expand on autism. ممكن ما سألت عنه لأنه في شوية indications يحتاج يكون عنده.
هتسأل شنو؟
نعم.
هتسأل شنو؟
هسأل إنه repetitive behavior اللي كانت حكت عنها والinflexible adherence to rituals، يعني إنه لأنه قالت إنه لما نمشي مع حاجة جديدة وكذا ما بتكون ما بتتكلم، وإذا كان قدر يكون علاقات أو صداقات مع الناس كنت أحسن من حياتي.
اوكي. اي زول عنده اي كومنت؟
يا أحمد, how old is this child?
5 years old.
5 years old, and he goes to school or preschool?
I'm not sure والله ما سألت السؤال ده.
Okay. What other questions you are supposed to ask? What other questions, important question, if you are having any probable diagnosis in your head, what questions you should ask the same line of the diagnosis?
إنه السلكتيف بيتزم ده في السكول بس أو في other settings، و ده السؤال الأول. والسؤال الثاني كنت حسأل عن الكريتيريا حقت الأوتيزم، دي الحاجتين كنت حسأل عنها.
Okay. Did you ask about his academic performance at the school? which reflect his IQ.
ما سألت، لكن الأم ما سألت صراحة.
Alright. طيب اوكي شكرا. زي ما قال دكتور ياسر any other participants would like to comment.
شكرا لك يا دكتور أحمد. بالنسبة في حاجة مهمة كان قالتها إنه أول حاجة هي prefer to be alone، واللعبات بتاعته هو بنصها. يعني كنت عايز أعرف إنه هل بيلعب اللعبة as it's supposed to be، يعني بيلعب اللعبات ولا بس just stacking them together، الطريقة اللي بيلعب بيها حتى ذاتها كيف. لو في أولاد تانيين هل بيحب يلعب معاهم ولا لأ، ولا he prefer to be alone. السوشيال كيوز، بيفهم الحاجات، يعني لما يكون الزول زعلان أو فرحان أو كده حوله بيكون فاهم ولا ما بكون واعي للحاجات دي. Thank you.
عندك مشكلة في النت يا أحمد؟ أنت في delay of your
لا لا، أنا معك.
responses.
لا لا، أنا معك. أتفق معه. وآي كان أسئلة مهمة كان المفروض تتسأل.
السلام عليكم.
وعليكم السلام. إيمان تفضلي.
وعليكم السلام ورحمة الله.
الله يسلمك. دكتور أحمد، هو في الهيستوري يعني ممكن يكون سأل أسئلة كويسة عن التريجرز والحاجات دي، لكن بفتكر بس يمكن في حاجة شوية كانت ناقصة، التعاطف مع الأم. يعني هي anxious وكده وكده، maybe كان مثلا إنه تشو شوية تعاطف معاها في الانكزايتي، وإني أعمل لها reassurance إنه إحنا مثلا يعني حنعمل assessment أو كده، يعني بس في الحتة دي أفتكر.
أتفق معك، أيوة صح.
أنا ما متذكرة دكتور إذا أنت سألت من المايلستون.
سأل
أوكي.
سألت منه.
أوكي.
وانا افتكر يعني the flow was going well. يعني عموما للانترفيو كلها فيش كوميونيكيشن مشكله حصلت في الاخر انه هي ما سامعاك، بيقول لك عيد الكلام تاني. دي بس افتكر دي حصلت عملت ديسكونكت لكميه من الحاجات، لكن otherwise يعني الفلو كان ماشي كويس. زي اي انترفيو دايما لما العيان ولا اهل العيان they provide you with a cue. يعني هسه الحكايه دي انه بيقول لك انه في الاخر يعني مثلا هي she's concerned about he's playing alone by himself. He's focused on a play, repetitive behavior. You should analyze this information rather than going on your checklist. This is a common thing again. Well, checklist here provides you with a structure, provides you with a frame عشان to follow up عشان ما تتوه. لكن أي time there is a cue, stop at the cue, analyze, ask questions, and then move back again to your checklist.
أوكي تمام.
طيب نمشي الكيس اللي بعده.
افتكر عندنا زمن لسه ثاني لكيس ثانية.
كلارا ده نمشي لكلارا.
كلاراي. منو اللي هيشتغل الكيس الثالثة؟
أنا دكتور ياسر.
تمام.
عمر.
لا
شغال يا دكتور عمر.
سيناريو اللي هو كلارا دانبوت is a 28-year-old woman who has been referred to your psychiatry clinic from a gastroenterologist. She has been experiencing frequent episodes of abdominal pain and shortness of breath. Gastroenterologist has ruled out any gastrointestinal issue. Your task is to take a psychiatric history and, if a possible, attempt to discuss the possible diagnosis. Begin a simulation. همشي سريع في دي عشان الزمن. البري ريدنج بيتكلم عن chronic symptoms that are distressing results in significant disruption of life. This somatization disorder, ICD-11. Somatization disorder falls under the category of disorder specifically associated with stress. Emphasizes the importance of symptoms not being intentionally produced or finged. Diagnoses require the symptoms to be persistent and typically for more than several months. الناس guidelines هتجاوزها شوية. الريكومنديشن برضو في الآخر understand biological and psychological and social factors. Initial management include validating the patient's symptoms, avoiding unnecessary medical tests, and considering psychological intervention and communication skills. Effective communication is vital when dealing with the patient with somatization disorder. Here are key points to consider. Empathy and validation, which is general لكل العيانين. Acknowledge the patient's distress without immediately attributing symptoms to psychological cause. Clear and simple language. Avoid medical jargon that may confuse or overwhelm the patient. Active listening. Show genuine interest in the patient experience and concern. انت في الاخر you agree ان the patient is subjected to distress what symptoms seems to be real to the patient. انت ممكن بعدين يكون اختلاف بينك وبينه هو what is causing this مش الهناية السفر patient is suffering. Set realistic expectations. Help the patient to understand the symptom improvement is a gradual process. Symptom exploration. Can you describe the symptoms you are experiencing? How do these symptoms impact your daily life? History of symptoms. When did these symptoms first start? Have you noticed anything that makes your symptoms better or worse? Previous medical consultations. Have you seen any other doctors for these symptoms? What was discussed or concluded? Have you undergone any treatments or tests for these symptoms? Psychosocial context. How has your mood been lately? Have you experienced any significant stress or changes in your life around the time the symptoms started? Functional and social impact. How have these symptoms affected your work, social life, and relationship? What activities have you stopped or reduced because of your symptoms? Okay, and أفتكر we should move on.
Hello, Clara. My name is Dr. Ali. I'm the psychiatric registrar here today.
قبل شوية مش منتظر لسه.
Okay, sorry.
Good afternoon. I'm glad someone is finally taking this seriously. Where shall we start?
Good afternoon, Clara. My name is Dr. Ali. I'm the psychiatric registrar here today. I understand that you have been referred to us by a gastroenterologist. How can I best help you today?
Yes, that's right. I really hope so. I've been dealing with these symptoms for months, and it's starting to feel overwhelming. I just want to understand what's happening to me and see if there's anything that can actually help.
I'm so sorry that you have been going through this. Can you tell me more about your symptoms?
It's just hard to put into words sometimes. I keep having these episodes, pain in my stomach, and then suddenly I can't catch my breath. It comes out of nowhere, even when I'm not doing anything stressful. I've had so many tests, and everyone keeps telling me nothing's wrong, but it doesn't feel that way at all. It's making me anxious all the time, and honestly, I'm exhausted.
It must be really frustrating that nobody is believing you or telling you what's going on with you. I'm so sorry about that. How have these physical symptoms been impacting your day-to-day life activities?
It's affecting everything, honestly. I used to be really focused and confident at work, but now I'm constantly worried I might have an episode during a meeting or in front of my colleagues. Sometimes I avoid going out or cancel plans because I'm scared the pain or breathlessness will start again. Even simple things like shopping or taking the metro can make me anxious. I feel like I'm not myself anymore, and it's really isolating.
I'm so sorry that you have been going through this. I'll try to help you to see what's going on with you. You said that it's
Thank you. I appreciate that. Sometimes I just need someone to really listen and not brush it off. It's been so frustrating trying to explain it to people who don't understand how real it feels. If there's anything you think could help me get back to my normal life, I'm open to trying.
Thank you so much for trusting me. I would like to ask you a few questions if you don't mind.
Of course, you can ask me anything you need. I just want to get to the bottom of this.
Sure, Clara. So when these abdominal pain and breathing issues happen, does it goes through your mind and how serious they might be?
When it happens, it feels really intense, like a sharp pain in my abdomen that just takes over. The shortness of breath can be frightening. Sometimes I feel like I can't get enough air, even if I try to calm myself down. The episodes can last anywhere from a few minutes to over half an hour. Sometimes it's so bad I have to stop whatever I'm doing and just wait for it to pass. It feels very serious to me, even if the tests say otherwise.
I'm so sorry, Clara, that you have been going through this stressful situation.
Yes, it's definitely stressful. It's like I'm always waiting for the next episode to happen, and that just adds to my anxiety. I feel tense most of the time, and it's hard to relax or focus on anything else. It's exhausting, both physically and mentally.
I understand, Clara. So regarding this pain and breathing issues, do you usually tend to go to the ER or the emergency room immediately after?
I've thought about going to the ER a few times when it was really bad, but I usually try to manage it myself first. I worry they'll just tell me nothing's wrong again, and that makes me feel even more helpless. Sometimes I call my family, but they get anxious too, so I end up just waiting it out at home. It's scary, but I try to avoid the hospital unless it feels absolutely unbearable.
I totally understand, and it must be difficult. Regarding your anxiety, Clara, can you tell me more about that?
My anxiety has definitely gotten worse since all this started. I feel on edge most of the time, like something bad could happen at any moment. Even when I'm not having symptoms, I worry about when the next episode will come. It makes it hard to concentrate at work or enjoy time with friends. Sometimes I have trouble sleeping because my mind just won't stop racing with worries about my health and what might be wrong with me.
I'm so sorry, Clara, for the experiences that you're having. I would like to ask you another question, if that's okay with you.
That's okay, you can ask me. I just want to figure this out, so I'm willing to answer whatever you need.
Sure, thank you. So, do you tend to spend time researching your symptoms, checking your body, or scheduling doctor appointments?
Yes, I do that a lot. I find myself looking things up online almost every day, trying to figure out what could be causing all this. Sometimes I check my body for any new signs or changes just in case I missed something. I've had quite a few doctor appointments lately, but every time the results come back normal, it just makes me more confused and worried. It's like I can't stop searching for answers, even though it usually just makes me more anxious.
And you're saying that every doctors you've been going to, they're saying that the tests are negative and there's nothing wrong with you. Is that correct?
Yes, that's correct. Every time the tests come back normal, they tell me there's nothing physically wrong, but I still feel the pain and the breathlessness. It's so frustrating because I know what I'm feeling is real, but it feels like no one believes me. Sometimes I wonder if I'm missing something serious, and that just makes me even more anxious.
I understand. It must be difficult, Clara.
Yes, it is difficult. Sometimes I feel so alone with all of this, like no one truly understands what it's like. Even people close to me try to help, but I don't think they really get how much it affects my life. It's exhausting, physically and emotionally.
I'm so sorry, Clara, that you have been going through this. But let me ask you another question. Was there anything stressful or changing in your life around the time these symptoms first started?
There wasn't anything obvious, at least not at first. Work has always been demanding, but I've managed before. I guess I did start feeling more pressure at my job a few months before the symptoms began. And sometimes old memories or worries come up, but I try not to think about them. I can't say for sure if that's connected, but it's been a tough period overall.
I'm so sorry, Clara, that you have been going through this.
Yes, I have, for about 6 months now, maybe a bit longer. It's been really hard, and I feel like it's taken over my life in a way I never expected. I just want things to go back to how they were before all of this started.
I totally understand, Clara. So regarding your anxiety,
I know.
have you seen any psychiatrist or psychologist regarding this anxiety level?
No, I haven't seen a psychiatrist or psychologist yet. I've thought about it, especially lately, but I kept hoping the physical symptoms would just go away on their own. Now I'm starting to wonder if maybe talking to someone could help, since nothing else seems to be working.
It will definitely help. So let's explore this by the end of the interview. But for now,
All
do you
right.
have do you have any do you deal with any long-term physical issues that takes a toll on you?
If No, I don't have any long-term physical health conditions that I know of. Before all of this started, I was generally healthy. It's just these new symptoms that have completely changed things for me.
And you said that it did start to affect your daily life activity, like going to shopping or going out, and even at work. It does affect you. Is that correct?
Yes, that's right. It affects me at work because I'm always worried about having an episode in front of my colleagues. So I sometimes avoid meetings or important events. Even simple things like going shopping or meeting friends can make me anxious, and sometimes I just cancel plans altogether. It's like my world has gotten much smaller because of all this.
I understand, Clara. That must be difficult. Regarding these symptoms, do you feel like there is anything that would make it flare up or change or increase?
Honestly, I haven't noticed a clear pattern. Sometimes it comes on when I'm stressed, but other times it just happens out of nowhere, even if I'm relaxed or doing something normal. I wish I could figure out what triggers it, but so far, nothing seems to make it better or worse in a predictable way. It just feels so random, and that makes it even more frightening.
I totally understand, Clara. Do you have anything that you would do is to make you less stressed? Like, do you do kind of yoga or other stuff like that?
I've tried a few things, like deep breathing exercises and herbal teas. My family always suggests those. Sometimes I listen to music or go for a walk if I'm not too anxious. I haven't tried yoga yet, but I'm open to it. Honestly, when the symptoms are bad, nothing really seems to help much. It's hard to relax when I'm so worried about what's happening to me.
Thank you, Clara, for clarifying whatever you're going through. And I would like to ask you, how is your relationship with your
Thank you.
family?
If you mean my relationships with people close to me, it's been complicated. My friends try to be supportive, but I think they get tired of hearing about my symptoms, and sometimes they just don't understand how much it's affecting me. My family wants to help, but they're also quite anxious themselves, so sometimes it just makes things more stressful for everyone. I feel misunderstood a lot of the time.
I understand. How is your appetite?
My appetite has definitely changed. Some days I just don't feel like eating at all, especially when the pain is bad or I'm really anxious. Other times I try to eat normally, but it's hard to enjoy food when I'm worried about how my body will react. Overall, I think I've been eating less than usual.
Okay, what about your sleep?
My sleep has gotten a lot worse since all of this started. I have trouble falling asleep because my mind keeps racing with worries, and even when I do manage to sleep, I wake up a lot during the night. I feel tired most days, like I never really get proper rest.
regarding your interrupted sleep, are you having nightmares or what's going on? What prompts you to get up from sleep?
Sometimes I do have nightmares, but they're not always about my health. Occasionally, I wake up feeling panicked, like something bad is happening, even if I can't remember the dream. Other times, it's the physical symptoms themselves, like pain or feeling short of breath, that wake me up in the middle of the night. It leaves me feeling unsettled and makes it hard to get back to sleep.
I understand, Clara. That must be difficult.
Thank you for saying that. It means a lot to feel heard. Sometimes I just wish things could go back to how they were before all of this started.
It will. If you don't mind me asking, Clara, regarding your family history, is there any psychiatric or mental illness in the family?
Yes, there is. My family has a history of anxiety. My mother and one of my aunts both struggle with it. Sometimes I think that might be why I get so anxious myself. It feels like worry just runs in the family, and we all tend to overthink things, especially when it comes to health.
Okay, thank you for letting me know that. And would you be open to explore therapy like CBT or cognitive behavioral therapy?
Yes, I would be open to trying therapy, especially if you think it could actually help with these physical sensations and my anxiety. I just want to feel normal again and get some control back in my life. If CBT or something similar could make a difference, I'm willing to give it a chance.
Thank you, Clara, and it will definitely help you. So, Clara, is there anything you would like to add to this interview?
I just want to say thank you for listening and taking me seriously. It means a lot after so many appointments where I felt dismissed. I really hope we can find something that helps, because I can't keep living like this. That's all for now.
Thank you so much, Clara. And I do believe that we're gonna find the help that you needed today.
I really hope so. I want to believe things can get better. Just having someone listen and not brush me off already makes a difference. Thank you for that.
You're very welcome. Thank you, Clara.
Thank you. I appreciate your time and understanding.
دكتورة موجة ممكن توقفيها.
Okay.
All right. If you need
سؤال لك تاني يا عمر. What do you think went
Adit,
well? What do you think could have been done differently?
being compassionate with the patient. حسيت إنه الحاجة دي ساعدتها كثيرة، حتى ادتني positive feedback في الموضوع ده. بالنسبة للحاجات اللي مشت كعب، يعني ما مشيت بالهيراركي أو الترتيب بتاع بتاع يعني systematic. ف I missed some stuff، يعني I did not go over الكلام بتاع يعني to check or to clear if any say يعني البايبولر، يعني مشيت في depression شوية. I didn't clear any مثال symptoms بتاعت bipolar أو بتاعت أنا لقيت الكلمة ضايعة مني، يعني delusions, hallucinations، حاجات زي دي just to make sure أنه there is nothing wrong regarding الحاجات دي.
ما حقول لك ما relevant لكن less relevant في القصة دي
Yes.
في الكيس دي. هي في الفريم في الاخر بتاع التشيك ليست it just keeps you يعني to cover all the bases، لكن يعني في الاخر you have to go where the patient and the symptoms يعني takes you. فانت you've done well with regard to this.
ثانك يو.
انا بس عندي كومنت، بس افتكر هفتح للناس دي كلها يعني تكومنت. دايما لما تشو سيمباثي حتى مثلا ولا امباثي مع العيان، يعني ما تقول له اي اندرستاند، فيقول لك والله انت لا اندرستاند ولا حتى يقول لك it sounds terrible, sounds difficult. فهمت؟ sounds like you're going through a really difficult experience. لما تقول له اندرستاند ممكن يقول لك والله انت لا، اذا جربته لا اي حاجتين يعني. وبتحصل ساعات يعني في الناس لما they're
لا،
going
في
through a
في
really
كثير
difficult
كثير
time.
عيانين بجد قالوا لنا كده يعني في
يقول لك
السودان.
والله انت لا بتعرف، لا بقول لك اي حاجه. ف it's a better word انه it sounds you're going through a really difficult time from the way you're describing to me. يعني it seems to it's affecting your life in a negative way and you're really suffering. ف reflects the suffer by انت reflect back on their experience.
تمام ان شاء الله. ثانك يو.
شباب في زول عنده اي كومنت؟
انا برضو عندي كومنت تاني. مع انه سألت عن السايكاتريك، يعني اذا قابلت سايكاتريك دكتور، لكن ما سألت إذا medications what kind of medication that she's taking, whether it's psychotropic medications ولا لا.
دكتور مهجة، دكتور عبد الغني.
شكرا يا دكتور عمر. It was good. Uh, but have you asked about what are the stressors which provoke the somatization, the somatic symptoms? What kind of stressors she is facing?
هي قالت ما عندها، يعني ما في حاجة كده معينة stressful situation، يعني قالت لي she cannot pinpoint something specific that caused her to have these symptoms.
In this case, what are the possible areas you would like to ask which can provoke a stress to her? Where?
Family,
At work,
partner,
at work,
at work.
at home.
Correct. Yes.
كده.
Yes, correct.
فحتى لو البيشنت قال له I have no stressors، احنا بنسأله إنه how do you feel at work? How with your mates, your other workers, at home، مع الفاميلي members، مع siblings، مع الهازباند if she is married. I don't know، أنا ما بتذكر. Anyway، فدايما حتى البيشنت when they deny the stress we start to ask them about different situations. Okay.
Thank you, boss.
Thank you. Okay. No other comments. دكتورة مهجة، دكتورة عماد، دكتورة فتحية، دكتورة أيزول. Anyway.
في إيمان رافع يدها يا بص.
تفضلي.
السلام عليكم، يديك العافية دكتور عمر، كان جدا ممتاز. أنا في حتة الريسك ما عارفة هل انتبهت لها ولا لا، ما بتذكر. سألت عن الريسك اوف suicide أو إنها to seek يعني any help from outside، يعني medical field أو حاجة زي كده، risk to physical health و risk to self.
لا ما سألت عنه، وبجد هي حاجة مهمة، بالذات أنها بتقول إنه الانزايتي is overwhelming وكده، و she feels helpless. فكان بجد مهم. شكرا دكتور إيمان.
العفو، يديك العافية.
طيب إذا ما في كومنت أنا بس ممكن أعمل كومنت بالنسبة للناس كلها شاركت. أفتكر أي زول شارك الليلة استفاد. الاستفادة ما بالضرورة انك يعني انك الليلة يعني to present a very يعني excellent presentation. الاستفادة هي كلها اساسا انك ممكن حتى يعني you don't do well you take a feedback you implement. حتى زمانك لما كان عندنا مشكلة في الشبكة والناس عادة السيميوليشن ذاته السكند ترايل دائما was better than the first one. فthe process كلها هي فيها الليرنينج مش الاكومبلشمنت مش في الاخر. فكل الناس الليله شاركت استفادت، وانا افتكر كل ما الناس تشارك زياده وزياده هتستفيد زياده. ف everyone today يعني they've done well انه الليله تقدموا الليله ودي volunteered انه يشاركوا. والناس always should volunteer تشارك.
شكرا لك يا دكتور ياسر. أنا معلش يا دكتور ياسر، بالنسبة للبيشنت يعني هي كان قالت لي كلام لما بتقول أن symptoms usually varies من 2 minutes لحد 10 minutes. حسيت أنه كان المفروض to explore برضه ال PTSD. Do you think it's relevant
اي
الموضوع ده
anxiety
ولا؟
بيجر anxiety معاها. يعني انت once presented with an anxiety you always ask about all syndromal anxiety.
مم. لأنه بالذات برضه قالت أن عندها nightmares، لكن ما تكلمت عن الفلاش باكس، ما تكلمت عن إذا في internal ولا external avoidance عموما يعني. آم، إذا في blame أو مثال if she's detached، يعني برضه كان المفروض تكسبلور الحاجات دي.
Good. I think it was good. We know the يعني patients ديل بيكون you need more than one interview with them so that you can reach a good conclusion about what they are suffering. هي مشت ل many specialties ولا بس مشت لناس الميديسين بس يا عمر؟
برضه يا بص
Did we
كان
go؟
المفروض أسألها هل نيورولوجيست، هل مشيتي
أيوة
لجي بي؟
obstetrician gynecologist يعني مع الفيزيشنز بنسأل عن if she has been seen by different disciplines. Yeah,
Thank you.
good. لو ما في حاجة افتكر it is time to say good night. شاكرين لك يا دكتور ياسر ودكتورة مهجة وكل الحضور من الأساتذة والترينيز، دكتورة إيمان ودكتور أحمد ودكتور عمر المشاركين الثلاثة اليوم. شكرا لكم. شكرا ياسر.
شكرا. تصبحوا على خير ان شاء الله.
انت من أهله. تصبح على خير.
يديك العافية يا بص.
الله يحفظكم.
شكرا دكتور ياسر.
شكرا
شكرا
لك.
دكتورة مهجة.
شكرا لكم، تسلموا يا رب، تصبحوا على خير.